So let's start with you, Dee. Tell me a little bit about what was happening in your life that caused you to talk to Dr. Fletcher about your medical situation.
Yeah, for a long career just playing, I played a hectic pace with how I got up and down the court and how much pain I put on my body. So when I was done playing, I had some issues in my hip, and people, was different in my head telling me about the timing of the injuries and what I needed to do. So when I talked to Dr. Fletcher, he really opened my mind and put me in contact with the right people at the time for me to go get my body right and get my health in order.
Okay. And how is the pain affecting your day-to-day life or your work?
Yeah, just being able to be physical, going to the gym, not being able to sleep at night, not being able to sit down and have meals, and it was just tough sleeping, a lot of pain, and for me, being able to just go back to my daily life of being able to be around my kids and going to the gym and working out, it was really bothering me and putting an effect on me because I was really in a lot of pain.
So, Doc, when someone comes to you at this stage where work and daily life are being disrupted, but maybe they're not sure exactly what they want to do, what stands out to you right away? How do you figure out what they need to do?
First of all, listen. You really want to know how much impact it is on their life. And so we have some questionnaires that sort of are standardized that will give us some kind of measures about their functional outcomes. But I think number one is just listen. And usually the message comes through that they can't stand to deal with it anymore. They need some solution. And oftentimes if it's a joint replacement issue, they're always told you're too young to have it done. And my message is you're never too young to have it done to be out of pain and have quality of your life. I mean, I always use the message, hey, get it done now. You could be hit by a bus 10 years from now. You wouldn't want to be waiting. And life is short, and so that's what I try to tell my patients.
Great. So, Dee, as a college basketball coach, your job is physical, and being on your feet is just not optional. You have to be able to do that. How is the pain impacting your work and your routines at work?
Wouldn't be able to get out there and really physically show them. For me, I'm very active, so I want to get out there and be able to get on the court, show them, how it's done, but also just movement, walking, being able to when we travel, be on the bus and sit for periods of time. It was just impacting work just due to me being able to move around, be with the guys, and just have a positive, mindset and smile. When you're in pain, it causes you to change to a different person. So for me, I just always wanted to be active. And when I show up to my guys, I want them to see me in good spirits, and for me to get out there and get the sweat equity that they deserve.
Yeah. So, Doc, how does the physical nature of someone's job change the urgency or the approach to their care compared to somebody who maybe sits at a desk?
Well, a person who's got much more physically demanding job, you have a higher sense of urgency because they're going to make the condition worse. They're going to have a hard time fulfilling their job duties. So usually that situation certainly dictates really putting them on a fast track to get the care they need. And again, I give them the message, you shouldn't put it off. Get the care you need now.
So once you realized this was something that you just couldn't push through and pain was just going to keep going, how did you think about timing and the next steps? Or was that dictated by your surgeon?
It was dictated by Dr. Fletcher, actually. When I reached out, he pointed me in the right direction, put that confidence in me to go get it. I just alluded to that. Sometimes it's all about timing. It's all about going and just say, I got to get it done now. Get the proper care you need now to get yourself out of pain and address your health issues. And again, whatever voices that you have around you, I hope they realize that they ain't feeling what you're feeling. They're not going through what you're going through. So if they did, maybe they'll talk to you differently. But that's why you got to have people who genuinely care for you. And when I talk to Dr. Fletcher, he's passionate. He understands that living quality of life it matters, and timing is everything. But if you are in major pain, you should handle that and address it at that moment.
Yeah. So, Doc, when you talk to a patient and they're told it's going to be 4 months before you get into some specialist, what kind of reaction are they giving you when they're telling you that? Like, tell me how you then resolve that.
Well, I usually say that's unacceptable to me. And if you're coming to me to help you, what I'm successful at is fast tracking the care, getting them the treatment they need as soon as possible. And it's all about relationships, knowing the docs around the state of Illinois that I can go to and lean on for referrals. They like the patients I send because I do all the work ahead of time. I tee up the case for them. They know these patients that I have are genuinely wanting to get better, and I'm going to help facilitate their return to function or work. And I'm going to make that surgeon look good because they're going to have a good outcome. And they're going to tell their friends. And I still think word of mouth is the best way to advertise a business, even more than social media or ads. And so that's what I do. It's just basically, I have a network of doctors that I work with that I'm able to get people into. And that's what I did with Dee.
So, Dee, after you talked to Dr. Fletcher, how did the pace of your care feel different? Was it faster than you expected? Was it everything you hoped for? How did that feel?
You can just tell Dr. Fletcher built his life on building relationships. You know, when I meet different people, and so happened to be my surgeon, it was fast paced. It was right when I was done with the surgery, Doc reached back out to me about 3-4 times, sent me some ice machines, sent me all the things I needed to make sure I recovered, and the care was good. It was top notch, first class, and it really made me feel better, not just physically but mentally as well, knowing that you got people behind you that care for you and want to see you do well.
It's the aftercare that really makes a difference in staying in touch with them and making sure they feel you've got a clear path for their recovery. For Dee, he had actually talked to me in 2015 about he didn't know what to do and direction. I said, when you're ready, come back and talk to me. Well, he came back and talked to me in 2023. He was ready. And so I was able to get him hooked up. I gave him a couple options and he got hooked up with Dr. Sporer at Rush. I think he saw him within a week after we made the referral. He was on the surgery schedule within 2 weeks. So you're talking, basically 2-week turnaround. Had the surgery, kept in touch with him, got his rehab. He was down here in Champaign 2 weeks later. So it was just wonderful to have that type of experience where he got what he needed, and it's a great success story.
Yeah, this is not the first time you've told this story.
Right.
Like this is patient after patient after patient where you've talked about fast track care. Why is it that you can provide that when other people can't?
Well, I think one, it's my passion, because I'm not going to just take it for granted. I'm not going to wait for things. I mean, my job is to help people get better, and I really get a lot of pleasure of people that appreciate you're going the extra mile for them. And plus, I have the advantage, I'm independent. I'm not beholden to anybody but my patients. That's who I work for. I don't have to send them through a health system. And so that's what my patients tell me. In fact, I listen, I get them to the right doc, the right time. And so that's what it's about. And just having done this for a long time, achieving results and satisfaction with patients. And it's just how I would like to be taken care of as a patient.
With your surgeon.
Mm-hmm.
So, Dee, docs set you up with a surgeon. How'd that go?
I was surprised on how fast he got me in. Like I said, it was a 2-week window where I went to see him. 2 weeks later, I'm on the docket to get surgery. It was, again, I see why people are afraid, have those nerves of like, man, I gotta go under the knife again. But for me, I was excited that the process moved fast, and all I thought about was getting out of pain. And it was an easy process. Again, I felt I was with the people who knew what they were doing, they cared for me, and they was passionate about their work, and it made it easy for me to go in and get the operation.
And do you feel satisfied with the surgery and the outcome?
Absolutely. I would tell anybody who's living with pain right now, I feel bad for you. I've been through it. I held it off for a long time. You need to have voices in your mind and your ear and reading the right stuff to try to tell you that your health matters, your life, your work. It will be effective if you don't get that, if you don't get it checked out, because it's painful. And I remember that pain. I remember what it did to me. So after surgery, for how I feel, besides it getting cold outside and I can feel it in my bones, I feel awesome.
And how does it make you feel when you hear something like that?
Well, that's what I'm passionate about. That's what I went to medicine for. It's not just making a good living, it's making a difference. And those stories keep me motivated to continue to fight to get patients the care they need and work on expediting their care.
Wonderful. So tell me, what's life like today versus what it was like before surgery?
I sleep good. I'm not in pain. I just feel really good. I would say health-wise, before the surgery, I was in pain. I was in bone on bone. You know, I knew when I went and get my evaluation of what they told me, I was bone on bone. You can either live with it or get it addressed now. But again, I was young, so I heard, you should wait 10 years. You should wait down the road. I don't want to live with pain. So for me, I just smile. I feel good. I like to deliver my message passionately because I've been there. I have a different experience when I know I've been on the other side of it where I didn't want to go in. I wanted to prolong it, and that prolong made me angry. Made me, wake up and, after 3 hours of rest and not being able to sleep. I understand everything that people go through, and it's not a manual for how you deal with it. But one thing I'm happy I had great support behind me. I had good care and people who directed me to the right people to address those issues. So now I feel good. It's about each moment I wake up, remembering that, how that felt, and that's why I can speak so publicly about my health and what I went through, because it really changed my mental and my physical way of just looking at life and looking at people who are dealing with the same things.
And Doc, how does that make you feel when you hear Dee say stuff like that?
Well, it's a wonderful feeling, because that's what it's all about, is just making sure you made a difference in their life. And that's, why I wake up every morning passionate about taking care of injured folks.
And so, Doc, what should people look for in a provider if they want care that is both high caliber and efficient?
Well, I think number one, does that provider listen? I mean, one of the things in today's society, we have providers, when you go in the room, they have their head stuck in a computer. And that's something I don't do with my patients. I want to look them in the eye. I want to listen to them. So I think that experience of having that one-on-one communication, that you feel like you're being heard, is really, really critical.
Wonderful. Is there anything else that you want to put in this video? Anything I missed?
For everybody out there that's listening, I told you, I know how hard it is. I've been there. I understand taking care of your health, it should be priority number one. Don't live through pain. It really takes you to a place and turns you to a different person. And once you get it done, it will be you will feel so much better, because you've been through so much. And many cases, people have been going through it for years. So it's a thing where all you know is pain. That's not what the human body is about. That's not what the mind is made up for. That's not what life is about. And it does impact you, life and work. And for me, I tune my body up. It's probably genetic that my hips was gonna give out anyway. But for me to go through that process, I'm happy I did, because it opened up a lot of doors for me to talk to people and help them as well, because a lot of people I hang with a little older than me, and they still in their mind like, I'm not gonna get this checked out. I'm not gonna go and go see someone. So for me, I just thank everybody that's in my circle. I thank Dr. Fletcher for being a mentor, being the guy that cares for me and really took me under his wing of really understanding what's important, and it really changed my life. So I'm very grateful, and I want to speak to people who are dealing with the same thing that I went through, that it will get better, but you got to make the decision.
Doc, anything?
Good. I think we covered it. I mean, I think we really got the message across, is don't wait. I think that's the biggest message, is there's options. Explore your options. I think that's the number one thing to do.
Took me 8 years, Doc.
But you got there. But you were a lot younger. You were still in your early 30s then. You were 39 when you got your hip done, and that's still pretty young for some folks. So
It took me 47.
Yeah, they gave me.
So I'd have waited 15 years of.
I was told when I was 42, I was told I needed to be 50 before they would do my knees. They said, "You're too young. You were too."
And
It's
you don't
great.
and you don't look back. Patients would say, "Why did I do it sooner?" That's the thing I hear the most with people, and I think it's success stories like these that really, I think, get people to at least be more open-minded to consider it as options.